Well, studies reveal the elderly are at greater risk for problems like dental decay and gum disease, but there are ways to care for our teeth and dentures as we get older. Restorative and cosmetic dentist Cez Acero-Taping shares some advice. Doc Cez, thank you so much for joining us on The Final Word. So tell us, how does our teeth change as we age?
Hi, Sir Rico. Good evening, and good evening, CNN Philippines. As we age, sir, no, there are a lot of changes that happens in the mouth, such as loss of teeth, cervical recession, or yung bumababa yung ating mga gilagid. Also, dental caries. So we really need to be mindful that as we age, there are certain changes in our mouth. So it's best talaga that we have it checked every 6 months.
Okay, so what about the buildup of plaque on our teeth? How often should we have our teeth cleaned, Doc?
Well, our plaque build up, it's a normal day-to-day thing because as we eat, most especially if you forget to brush our teeth, the longer it stays in the mouth, the more dangerous it becomes. So it's very important that you don't just brush 3 times a day. You have to go to your dental practitioner or your dentist every 6 months so that yung mga hard deposits, sir, no, matatanggal. Because there are deposits or plaque that cannot be removed by simple toothbrushing.
Mm-hmm. And how often should we brush our teeth per day? And what is the best type of toothbrush and toothpaste, particularly for the elderly?
Oh, well, whether elderly or adolescent po, it's very important that we keep the number 3, no? 3 times a day, 3 minutes. Yan ang ating magic number. And it's very important that we look at our bristles because it's very important na ang ginagamit nating bristles are not too hard. Because if we use bristles that are too hard, it might scratch or even lacerate our gums. So it's very important that we keep it na soft tip bristles lang.
Okay, so because some people know when they brush, it's really very hard, and when that happens, sometimes the gums bleed. What could be the repercussions?
Well, we recommend that we actually brush in circular motion po, no? Meron pa tayong ginagawa na we angulate it a little 45 degrees, vibrate ng konti dun sa gum area, then circular motion, swipe down. It's very important na careful po tayo sa pagbabrush. Huwag yung horizontal motion, tapos hard motion siya because nagugupit or nalalacerate or nasusugatan yung ating mga gilagid.
Alright, apart from brushing your teeth, Doc Cez, how important is it to also use mouthwash?
Okay, that's a very good question, sir, because our usual recommended regimen is not just brushing, we also have to take into consideration flossing. Because there are areas in between the teeth that cannot be reached na by the bristles. So it's very important that after we eat, we floss so that yung mga pagkain na naiipit in between the teeth ay natatanggal. And for the mouthwash naman, the mouth rinse, it's also good to always use mouth rinse right after eating. And of course, the mouth rinses also would help us keep our salivary pH neutral. Kasi pagka bumabayan, pag masyadong acidic ang ating mouth, doon nagsistart ang mga cavities. So ang magandang regimen po natin ay brush, floss, and rinse.
Ayan, very good advice from Doc Cez for all our viewers right now who, of course, will have to brush their teeth before they go to bed. Let me ask you about dentures, Doc. Are they inevitable among older people?
Well, when we say inevitable, that's unavoidable. No? We can actually avoid it. I met old patients who take very good care of their teeth. So, buo pa yung mga ngipin nila.
Oo.
But huwag tayong matakot sa dentures. Kasi pag talagang meron na po tayong loss of teeth or missing teeth, it's very important that we replace them back. So that when we bite, meron tayong tinatawag na balanced occlusion. Very important po yun na balanse ang ating kagat because it will not only help us with confidence, but actually it will help us with our nutrition kasi nakakakain po tayo ng tama. Maayos po tayo nakakapagsalita at hindi po tayo nagkakaroon ng mga bumababang buto or minsan pumapasok yung mga cheek natin dito. So, it's not only just confidence, it's really function. So, pwede siyang ma-avoid by taking good care of teeth. Pero pag talagang kailangan na siya, be open to it because you'll be able to smile and bite efficiently.
Ayan, pearly white teeth. Hindi ba ang pinaka-importante when you smile from ear to ear? Thank you so much for all the advice you've been sharing with me and our viewers this evening on The Final Word. Restorative and cosmetic dentist Cez Acero-Taping. And you can get more health tips on Med Talk Health Talk, hosted by Dr. Freddy Gomez, with new episodes every Tuesday at 3:30 in the afternoon.